Dr. Jeff Kingsley. This is another edition of Riding in Cars with Researchers. Today we are continuing a series where we're going to talk about study site metrics, specifically a balanced scorecard. So a quick recap of what we discussed in prior episodes. A balanced scorecard is the sweet spot of KPIs, key performance indicators. Your customers, a site's customers, need something from you, and I argue they need EQTCS, enrollment, quality, adherence to timelines, and customer service. Your balanced scorecard is the balancing point of the health of your research site with servicing the needs of your customers. I would argue that EQTCS needs to be in any site's balanced scorecard. The last episode, we discussed quality, the Q of EQTCS. Today, we're going to talk about timelines. Our customers need us to move rapidly on everything. Our customers want us to be able to make rapid decisions on feasibility questionnaires, rapidly start up a study, rapidly enroll the first patient in that study, quickly do query resolution, database lock. Our customers want responsiveness. Now, why do they want it? Just because it's nice to have somebody who's responsive to you? Sure it is, but it's actually deeper than that. If you invent the cure to cancer today, you file your patent today. And your patent has a finite lifetime. You don't wait until you actually know that you discovered the cure to cancer to file your patent. You filed your patent before you knew that it was the cure to cancer. And that patent clock is ticking. It takes way too long to get through the R&D pipeline. It takes 15 to 20 years to complete research and submit that data to FDA for approval. And that length of time is eating away at patent life. That's one of the leading causes of why drugs cost what they do when they get their FDA approval, because the owners of those compounds have to make back a massive investment before they ever even begin turning a profit on all of those years of work. So they care about timelines. The faster you can move, the longer they have patent life, the cheaper they would come to market. Now, let me say that again, because a lot of people don't really realize that. Sponsors don't want to have to come to market at a very expensive price. Trust me, they really don't. If they come to market at an expensive price, they struggle more to get physicians to write for their medicine. Or if physicians do write, there's a higher likelihood the insurance company denies payment and doesn't allow their patients to be on those drugs. It's harder to get on formulary. So the higher the price, the less they actually gain utilization of that drug in healthcare. If they can come to market more cheaply, more physicians would write for it, more patients would have it paid for, more insurance companies would allow it on formulary. So actually, if we can do R&D faster, drug prices will come down. It's amazing. It would be a wonderful thing. So think about it. If we can work faster, we serve our customers better, we speed innovation, we get new drugs to the patients that need them faster, and we reduce the cost of drugs when they get to market. All of that just by moving more quickly. Time is easy to measure. So this is another important thing for sites to recognize. Our customers track time on us very easily. If you're slow, your customers know it, and they are tracking it, and it's in their databases, and it will impact study award at your sites. You've got to move faster because it matters and because it's easy to measure. Now, let's talk about things you can do to move faster, and that'll be the end of this segment. Most of the time in what we do in clinical research is frankly wasteful. It doesn't really take that length of time. On average in the US, it takes 26 weeks to do study startup, half a year. It's not half a year worth of work. It's a tiny fraction of that. And between a small piece of work, there's a long period of waste, a long period where really no one's doing anything. It's sitting on somebody else's desktop to kick back a contract and budget. And then the recipient does a very small amount of work and kicks it back. And again, it sits on somebody else's desktop. And the same is true of pharmacy startup and lab startup and IRB approvals and all of the other things that we do. Here's something that you can do. Don't graph the length of time it takes to do study startup. Graph the actual length of time for the actual activities performed. So for example, if on average it takes you 2 months to do contract and budget negotiation, go talk to your contract and budget people. How long does it actually take them to do the first review of the contract and budget and kick it back to the sponsor? That's the actual time. And then find out what's the average length of time before the sponsor ever responds. That's waste, largely waste. Not entirely, but largely. What if we could shave just a few days from that interim period? All of those days cumulatively add up and make a huge difference. Think about it, and you'll find all sorts of other ways to shorten timelines in your research trials. If you shorten timelines, your customers will appreciate it. 1. 2, you will help get new innovation to the patients that need it faster. And 3, believe it or not, you will assist with reducing the cost of medicines when they come to market. Thank you very much. Follow us on YouTube. Follow us on all of our social media channels. YouTube, LinkedIn, Instagram, Facebook. I greatly appreciate all of you who watch these. I hope that they provide benefit. I love teaching. Send me your comments. Send me your suggestions. Happy to continue to do these. Thanks for riding along, and I'll see you next time.